So today we're going to talk about low back pain and all of the misconceptions out there when it comes to treating low back pain. So let's take a look at some of the biggest misconceptions. So number one, low back pain is due to a low back problem. When we see low back pain patients, we hardly ever touch their lumbar spine because the low back, once you figure out how to evaluate people and get to the root cause, you'll figure out that the low back is doing way too much because it's compensating for other things that aren't working. So we never need to focus on the lumbar spine. Low back pain is due to herniated discs, osteoarthritis, and degenerative joint disease. So a lot of patients come in with imaging and they're freaking out because they've got all these problems. That's not the cause of low back pain. These things were going on for a long time before they ever experienced low back pain. Next is we should be treating low back pain with protocols because low back pain is the same across the span. That is completely incorrect. Just like with any other diagnosis or complaint, we should be breaking people down as individuals and figuring out what their specific issue is. Throwing a protocol of stretching and massage and corrective exercises at a low back pain patient is not going to work. We should be treating low back pain with symptom modification gimmicks like foam rolling, cupping, needling, ultrasound, Graston, whatever the cool thing is out there. If we're doing that, we just forgot that low back pain is not a low back problem, and we also forgot that gimmicks, gadgets, and garbage don't ever get to the root cause and should never be used. It's not okay to exercise with low back pain. We should be loading and getting our patients to move as much as they possibly can when they come to us with a complaint of low back pain. It's going to take a long time to fix low back pain. So we should get immediate results after the first visit with somebody who has low back pain, just like we should with hips, shoulders, knees, cervical spine, feet. Everybody should respond very quickly if we are looking at the right things and getting to the root cause. They're going to need a lot of rest. So a lot of patients will come in and say, I threw my low back out, and so for the last week I've laid on the couch. Rest is one of the worst things you can do with patients with low back pain. Once again, this is not the problem. Exercise and loading is going to help us solve the real issue, so we should have them moving as much as we can. And last, it's really complicated to treat low back pain. So a lot of physical therapists think that the lumbar spine is so complicated. We think that it's one of the easiest things to treat because it's feeding off of everything else, and since we can treat everything else, the low back just falls in line and gets better.